Right, shall I take over and just
Yeah, is that all right, Oliver? If you could kick us off, that'd be great.
great, and then I'll hand over to you, Phil, to sort of take us forward. But it's really my job just to say hello and welcome everyone to the meeting, and thank you for making the time today to help us with the work that we're trying to do. I'm particularly pleased to have keynote speakers with us. Clearly not Sally quite yet, but Layla Moran, who I don't think is on the call yet, but will be joining us. Jess McGregor, Una Smith, Jackie O'Sullivan from the brilliant MenCap, an organisation very close to my heart. My uncle lived in a MenCap home for a number of years, very happily. So thank you to MenCap for the work you do. And Kirsty McHugh. I think 80 people plus have registered, so I'm sure we'll be joined by a few more throughout the course of the afternoon, which is great. We've got an impressive lineup, therefore, of speakers and people to take part in today's meeting, and we should have, therefore, a very informed and insightful meeting and conversation on what is, I think, a often overlooked topic in politics, partly because it's very difficult, but partly because I think politicians just don't want to touch these conversations sometimes. So really keen to actually get into the weeds of it and figure out if we can't offer some sensible recommendations and a clear proposition to Baroness Casey and her independent commission, and when they report back on phase one of her inquiry in 2026. Phil and Steve have produced an excellent paper, a really good background paper, which I hope some of you have had the chance to read. I realise, though, with busy diaries and time, that might not always be the case. So I was just going to quickly, if I could, just go over the 10 key questions that we're wanting to consider, just because it might be helpful for everyone on the call just to have those front of mind as we go into the conversation this afternoon, because I think they are important. So forgive me this interlude just for a couple of minutes. One, overall direction of travel. So to what extent do national frameworks such as the Fair Pay Agreement, the Care Workforce Pathway and Neighbourhood Health Service guidance provide a clear policy direction towards workforce professionalisation and place-based integration of social care? Two, funding reforms. What are the implications for social care in the reforms of local government finance and announcements in November 2025 budget? Three, care commissioning. To what extent should there be a fair cost of care hour approach to commissioning that includes pay on costs, training, management, other overhead costs? Capital investment. How can capital investment and planning for long-term capacity in social care become more sustained and aligned with market-shaping strategies to address geographical gaps and low quality in service provision? Workforce development. Should there be more government support to implement the care workforce pathway and to fund interim uplifts to pay before the Fair Pay Agreement is implemented to address the existing high levels of vacancies, the high turnover of staff, the low rates of retention, and the high use of expensive agency staff? That last one in particular for me is a really important question. Neighbourhood health and wellbeing services. How can we ensure that social care is a genuine equal partner in the new model neighbourhood health and wellbeing services that is much more than a delivery vehicle for NHS priorities and services? Phil, Steve and I were having some of these conversations just the other day in terms of what reforms do we need to see, certainly in terms of devolution, where I'm really interested about how we can make that left shift happen and how neighbourhood health can become a much more real proposition for our communities. Care quality. What should be the next steps for improving regulation and quality of social care, such as rebuilding the CQC's inspection capacity, prioritising community and home-based care oversight, etc.? Digitisation. Whilst digital transformation of social care is promising, what is needed in terms of funding, innovation, standards and inclusion safeguards to truly develop digitally enabled care? Unpaid carers. Should there be greater investment in support for unpaid carers? I would argue yes, but others will have to make their own mind up. I think unpaid carers get a very raw deal. Voice. Should co-production and advocacy in care contracts be a baseline standard to ensure that those who draw on social care support are fully involved in decisions about the services they receive? They are the 10 questions. There's a bit more in there if you could choose to have a quick look at those throughout the meeting, but I'd really appreciate everyone keeping those at the forefront of their mind as we have today's conversation. And in terms of the questions that you might want to ask some of those expert witnesses, maybe those will inform your thinking. So the Commission's been particularly busy in the last 3 months, and we're going to discuss some of that and the Commission's future programme later. But for now, I just wanted to hand over to Phil. And again, just say thank you to everyone on the call, and particularly to Phil and Steve for the work that you're doing. And it's a pleasure to be involved. Thank you very much.
Great, thanks, Oliver, and thanks for taking on the job of co-chair, which was confirmed at the last meeting. So, welcome to actually doing the role, although you've been doing it before the meeting today. And it's a chance for me to give my apologies for Imelda, because Imelda can't join the meeting, but sent her apologies. So I'm going to be sort of co-chairing with Oliver this part of the session. We are having difficulties, I think, connecting Sally up. We've tried her phone, her computer, and everything else. So while we still haven't got her, I'm going to ask whether or not we might have some of the people. So Steve, is Sally joining us or not? No.
Okay, sorry, I can tell you Sally is here on this
Oh,
phone. So, Sally, can you hear Phil speaking or me speaking?
I can hear you, Steve. I could hear Phil very faintly.
Okay.
right.
Can Phil hear Sally?
Yes, I can hear Sally.
So that means everybody can hear you, Sally.
Yes.
Okay, so I'll let Phil introduce you, Sally, and I do apologise that I think there might be a DHSC problem with Zoom, so apologies for that. But I think we're going to get there by hook or by crook. So over to you, Phil, and then
Okay.
thanks again, Sally.
Yeah, I think that this is taking the question of the DHSE involvement with the social care system landscape to extremes now. We're down to voice only in terms of the relationship. Sorry, Sally, that's very unfair, and I say that because I know Sally very well. Sally is, as you know, everybody, the new permanent Director General for Social Care inside the department, but has been a big ally and close colleague over many years. And indeed, when we wrote the first original white paper on building a national care service, in the bureaucratic jargon, the pen holder was in fact Sally herself. So fantastic that she's now got this job inside the department. And very thank you, Sally, for taking this somewhat obscure way of doing this, but this opportunity to talk to the Commission. You know all about the Commission. You've talked to us before in the past about what is happening. And so just to say to everybody on the call, Sally's clearly not being able to tell us what's going to be in the KC Commission review. That's not her job, and she wouldn't know anyway because it hasn't been discussed in those forms yet. But what Sally has kindly agreed to give us is an overview of what the department is already doing and planning to do itself regarding the social care system, reform of social care, and improving social care. So that's the context in which Sally, you're joining us. And I know, Sally, if you'll be followed by Lena Moran, who's the chair of the Select Committee, as you know. If you're able to take some questions before her from the Commission, that would be great. But we appreciate your scope for responding may be somewhat limited. So with that introduction, I'll hand over to you. And if this system works, if people can't hear, can you just kind of signal to us if you've got a problem, and we'll see if we can make this work. Over to you, Sally.
Great. Thank you so much, Phil. And apologies to everybody for keeping you waiting. I was doing a lot of frantic pressing of buttons and links to no avail. So apologies, and hopefully this works broadly for you. And yes, we're very happy to hang around for a few questions. So as Phil said, I wanted to set out how the government is thinking about delivering improvements in social care, predominantly over this parliamentary term, kind of as we are building the foundations of the National Care Service in advance of Louise Casey's phase 1 and then phase 2 reports that will come in 2026 and 2028. So what I thought I'd start with is perhaps some of the drivers of reform and the kind of different places they come from. What are we trying to achieve and what are our key objectives? And then kind of some of the kind of core fundamentals that sit underneath those objectives, and particularly then finish with a kind of reflection back to some of the spirit of the 10-year plan as well and how that connects. So in terms of some of the key drivers of reform and transformation and improvement in the sector, we clearly have a set of improvements that we want to see from within the adult social care sector, which is around how we can ensure we are providing really good quality care to individuals who need to draw on care. So we've got a sort of within the adult social care sector, how we want to drive change, and I'll come to that in a moment. We also then obviously have the 10-year health plan, which has a number of areas which create clear opportunities for adult social care in partnership with the NHS to be able to drive improvements and make changes as well. Some really key things there around neighbourhood health, A lot of the digital changes being a huge opportunity for how health and social care can better connect their information, and also some important advances around how we can use digital to support carers more easily, and a number of commitments around modern service frameworks, including on dementia. So we've got adult social care drivers, 10-year health plan drivers. We then have drivers of reform which are kind of coming from outside of the Department of Health and Social Care, but really important that we are maximising the opportunities of those and also minimising any risks they might create. And obviously prime within that is local government reorganisation and local government fair funding, where in particular with the latter, we're moving away from a world in which there were more central grants that were kind of ring-fenced and specific, and trying to shift as much money as possible into core funding for local government so they have the flexibility to be making the right decisions for their local community. So really living that sense of devolution. And then finally, there's a set of wider government changes that have significant implications for people who draw on health and care, so be that welfare or SEND reform, for example, housing. So lots of kind of drivers of reform that we need to kind of help be able to put together and kind of cohere into a set of changes that reinforce each other. And when I came into the post in the summer, I really recognised that a hugely busy set of reform levers and drivers, but actually what we didn't have in the department was a really coherent way to say with the sector, this is what we're trying to achieve together. This is how all these different parts all add up to a kind of a really strong foundations for a national care service. So since the summer, we've been working with partners right across the sector to really help us try and articulate a stronger sense of what are we trying to achieve and what the key priorities are. And that to me is really about saying social care is here to support and empower people to live fulfilling lives. It's recognising that wants to promote independence, but also really critically that we are all interdependent as well. So it's independence and interdependency. And we want people to be living in a place where you feel safe, connected and supported. So that's the long-term aim we want to shift to. The priorities that we are focusing on in this parliament, we have three priorities. One is around choice and control, the second around joined up services, and the third around quality of care. So choice and control, for us, this is about ensuring that individuals receiving care, drawing on care, are genuine partners in decisions about their care throughout their lives. And we're taking a number of steps to help improve current practice on that. So we're updating guidance on strength-based practice. We've been promoting greater use of direct payments and individual service funds. We are expanding the disabled facilities grant to give people choice about being able to stay in their own homes. And when it comes to care tech, we are developing a number of standards to mean that both individuals receiving care but also providers can be sure that the care tech that they are considering is going to meet their needs for their particular point in life and their particular needs. So driving strongly on choice and control. The second area is joined up services, and obviously this is where very, very close working with the NHS is very important, but there are wider joined up services, so joined up services with DWP and employment, with housing, etc. as well. But if we think about the NHS side of this, I'd highlight two kind of key areas of development over this parliament. The first is neighbourhood health services, which I'm sure many of you would have heard, an absolute key plank of the 10-year plan in terms of really trying to make both the left shift from hospital to community, but also from treatment to prevention. So how we can create a neighbourhood health service that, yes, has core NHS services at its heart, particularly primary and community health, but also connects to and partners with wider local government services, with the voluntary sector. So a strong set of commitments around neighbourhood health. We currently have 43 sites that are part of our national neighbourhood health implementation programme, and I've been meeting with DASs in those 43 areas to kind of make sure we're maximising the learning for social care in that. The second aspect of joined up services is that we are also reforming the Better Care Fund over the course of this parliament, and really what we're trying to do with our reform here is much more closely link the Better Care Fund to the overall aims of neighbourhood health. So particularly local government and local NHS services aren't feeling like they have one set of asks about neighbourhood health and a different set of asks from the centre about how they can use particular pots of funding. So over the course of this Parliament, you'll see us be reforming the Better Care Fund kind of step by step to create that much closer alignment between the Better Care Fund and neighbourhood health. The third priority is around quality of care. I think really two different aspects to draw out in quality care. One is to say our workforce is absolutely critical to the quality of care that we can deliver to people who are drawing on care and support. So really critical that we absolutely support our workforce, both from an appropriate level of reward and recognition, and the fair pay agreement is obviously a very, very big commitment from the government, backed by £500 million in the final year of this SR, to be able to make the first steps towards better reward and recognition. And I'm imagining we may well come back to the FPA in questions. We're developing the care workforce pathway, and we're also undertaking a number of pilots where we're wanting to really push innovation in the sector. So particularly around piloting having nurse prescribers in social care, which we think will both improve careers for nurses in the sector, but most importantly will improve outcomes for individuals who are supported by the social care sector. An important area around workforce, but also around quality of care are some of the really important kind of basic fundamentals, with a commitment for us to be replacing the dole system with a new liberty protection safeguards. So we're really making sure we're putting the needs of individuals right at the heart of a system that has, I think a lot of us would recognise, has become a bit clunky, has kind of created too much restriction on individuals. So really keen to improve that as well. So there are three priorities and some of the examples of the commitments that we're developing and delivering over this Parliament. I thought it was also worth just reflecting on a couple of things which for me are kind of the very fundamentals that sort of sit underneath how we ensure the social care system is really able to best meet the needs of individuals. And when I talk about this, Phil explained that I've been in and around this sector for a while. Quite a lot of what I'm just going to talk about now are things that we used to have 15 or 20 years ago to help us be able to lead and drive improvement in the social care sector. And for various reasons, those have not been in existence for the last few years. So we now have the Care Quality Commission doing assessments of local authorities, and the first round of that will all be complete the inspections will be complete by the end of this year, with reports being published early into next year. And that gives us a really strong baseline to understand local authority performance. That sits alongside improvement and intervention, which includes the potential for statutory intervention in really serious cases of failure and lack of improvement. So again, we have levers to be able to support and drive improvement across local authorities. We also then, this week, will be publishing a couple of new innovations to help us really be able to understand and support local authorities to be leading effectively. The first is a local authority priority setting document. So for the first time, we will be publishing a very clear letter to local government saying these are our priorities for local government with the settlement that you have. So we're hoping that will better align individual local authority decisions about what care they're commissioning, how they're shaping their market, how they're supporting their workforce locally, will better align to those national priorities. And that sits alongside, for the first time ever, notional allocations for adult social care for every single local authority. And as I say, those will be published later this week. And then the final bit I wanted just to reflect on before throwing open to questions and comments, Phil, is a connection back to the 10-year plan. So when lots of people talk about the 10-year plan, they can get kind of very, very technical quite quickly. They obviously talk about the 3 shifts, and then they might talk about new tariff systems and new types of organisations and new types of incentives or new quality systems. And that's obviously a really important part of how you make a vision a reality, is having that detail that sits underneath it. But for me and the Secretary of State, as we were crafting the 10-year plan, there were also 3 kind of more fundamental shifts around the kind of culture, the kind of system we want to be, how we want to behave, how we want to lead, how we want to kind of exist as a health service. And these three things, I think, are three things that social care are really good at. So for me, I take a real moment of optimism that I think the social care sector has a lot we can help share from our best practice and our good work to be able to help the rest of the healthcare system be able to really make progress on those cultural changes. And those three things are, the first is a different relationship with patients. So moving from an NHS, which is quite often paternalistic and does too, to one that's working genuinely in partnership with their partners and communities. So really kind of living and breathing that strong sense of co-production that we all know in social care. The second is moving from a system that is fundamentally not equitable, with poor experience, both in terms of access and outcomes, into a system that is driving progress on inequalities much more. And again, I think here, because our sector is so good at thinking about the individual, thinking about them holistically in the lives they lead, I think we have a lot to help be able to lead and share. And then finally, partnering differently. Too often the NHS thinks of itself as a single public sector institution that can only really work with itself. And to be successful with the 10-year plan, it's going to need to partner with local government, with the voluntary sector, with patients, with industry, with research in a very different way. And again, I think here, because of the nature of what care and support really is in people's lives, in their homes, in their families, in their communities, I think we're really good at being able to make connections to different types of organisations and different communities. So I thought I'd just finish there on that kind of, as I say, that point of optimism that we can quite often as a sector talk ourselves down and think we're a Cinderella. And actually, I think we've got an awful lot that we can do to help support the health and care system be able to make real that vision from the 10-year plan. Thanks, Bill. I hope this has continued to work for people.
Yes, it has, Sally, and that was very clear and a very good, as it were, tour d'horizon, as it were, of what you, the way you see the world, the government sees the world of social care. Just before I invite commissioners, I suppose my one observation from my point of view is there's a lot of moving parts at the moment. I think about obviously the Fair Pay Agreement you've mentioned, the changes to local government finance and the ring fencing and the role of notional allocations, the whole funding aspect, the care workforce pathway and the developments there, the neighbourhood health service, relationships with the NHS, obviously Louise Casey doing her work at some point, and the changes to the CQC, and you taking us through all of that. I suppose just a general observation would be it's how all of that is hanging together in a coherent way, given all that these different parts of the system that are moving at the same time. I quite like movement and change, but I can see how it does create challenges for providers on the ground, for example, wondering kind of what the impact of the FPA plus the local government finance settlement, plus the lack of ring fencing, plus the priorities of digital, how does it all fit together? So I suppose my only question would be, to what extent do you feel the government, the department across the piece is seeing all these various things and connecting it all up so that it is a coherent, progressive channel of transformation rather than a mixture of bits and bobs that might fit together? That would be the harsh way of looking at it, Sally.
So, to be honest, Bill, I don't think that's harsh at all. And I think that's the reflection of kind of me with the minister and the senior team here in the department over the summer was we were at risk of that happening because we weren't owning and sharing a clear kind of this is how we see all of this fitting together. So there was every risk. It felt like 25 different things that were all kind of pulling in different directions. There is actually kind of more coherence, even at that point, than people might suggest. You know, there's a strong drive about devolution, and that's everything that's around the kind of local government reorganisation and fair funding is around that. And we've got that aligned now to the NHS wanting to devolve more away from the centre. There's a strong kind of drive around really wanting to change power to the citizen. That's a particular language in the NHS, but as I said, in social care, we've got really strong examples of that. So I think there was more coherence, but I agree and that we needed to hold it all together. And that's what we've been trying to do with kind of having clear priorities. It is a difficult set of lots and lots of different moving pieces to hold together. What from as I see the role of the department, it's to make sure we've got really open and honest relationships with local authorities, with providers, with organisations representing individuals, with organisations representing our workforce, so we can understand where is it where is it kind of gelling and working? Where is it at risk of kind of friction and tension or drifting apart? So we can kind of try and really get a sense of how is this feeling much closer to the front line than I will ever be sat in Victoria Street. So again, since I've come in, I've been really keen to have lots more kind of open, honest conversations with the sector, with people who draw on care, so we've got a real understanding of where is it connecting and where isn't it. But so I kind of agree with a lot of the kind of principle of your challenge there, Phil.
Thank you, that's very kind. So devolution, Oliver, I'm just going to bring you in at this point as the new mayor of South Yorkshire and chairing the commission now. Any comments or questions you'd like to put to Sally? You're on mute. Oh, Steve, everyone's on mute, I think.
I think you have to unmute yourself. Sorry. Can you do that, Oliver? Sorry. Was that done?
No.
Oh, sorry. It was an on-screen thing rather than a button thing. Apologies. Sally, thank you for that. Actually, that was a really effective way of delivering a contribution. We should try that more often, where we just hear people like that. But that was really good. Thank you very much. I think, yeah, on devolution, I'm particularly interested because you sort of touched on it a bit, and then obviously just a bit more there in response to Phil's question. You said a couple of things. You said local priorities that need to be better aligned to national priorities, which as a mayor always sort of rings a little alarm bell, because it sounds a bit like sort of central control of what we will do locally, which I don't think is what you meant. So I just wondered if you might be able to just touch a bit more on devolution and the role of local decision making, either mayors or local councils. And you talked a lot about local government for obvious reasons, but if you might just expand on that a little bit more, particularly in the context of the first priority that you mentioned of the three, which was choice and control for users. And I'm always interested in the interplay between mayors, local government, and how we interact with citizens, maybe on a much more we're obviously closer to delivery than the national government is, and therefore feel like we have more insight sometimes into what local users, local people need. And I just wonder if you might touch on the interplay then, please, between national control, national oversight, what local control and local influence might look like, and how that will influence what users will feel differently on the ground.
Yeah, of course. Thanks, Oliver. And that's a great set of questions. And you're absolutely right. Yeah, I wasn't meaning this is kind of national government saying you all must do this and it must look exactly like this and smell like this. And it was much more about saying this is a really diverse sector, which is a huge part of its strengths. But also, as we move towards a national care service, we do need to create some coherence. There is national in the title for a reason. So what we're trying to do with the kind of clear priorities for social care is to be clear about the outcomes that we think we're trying to improve that are important to people, leave a lot of discretion locally about how you can best meet those, because I completely agree. Local government and other partners locally are much better placed to actually know what is going to work in these particular communities in your patch. But also, where we can, create the right levers, the right interventions to mean that you've got a very clear sense of what does the evidence say about good practice? How can we help roll out good practice in a way that isn't saying that has to be one size fits all, but it's saying what can you learn from somewhere else and apply? Where can we do things like with care tech and digitalisation, where us doing something nationally once, like setting very, very clear standards that all tech providers must meet, then gives local government and care providers the real assurance that they are then selecting from a market where any of those products will meet those minimum standards and will be able to be interoperable, etc. So we're trying to create an ability to, if you like, have local action enhance and support national ambitions, because they're three very, very big priorities, but not in a way that says, and we're going to tell you exactly how you need to do that, because that is absolutely not the direction we want to move in terms of how we are having a relationship between central and local.
Thanks, Sally. I'm going to invite commissioners. If you'd like to ask a question or make a comment, please put your hand up or signal in some way. I'll try and look at my screen and see you. I've got Nadra. Nadra, do you want to kick off? Short questions, please, because we can get some more in. Nadra.
Hi, thank you. Thank you for that. I galloped through, which was really helpful. I suppose
so many attempts to advance some kind of reform, whether it's still not or something else. And we actively said we want to support Casey. We see this as an important point in our nation's history, because there are so many people now with unmet need, and I know many of you know that better than I. There was a big focus on unpaid carers and the hidden costs that they have, particularly young unpaid carers, the lifetime costs of them being underrepresented in the workforce. They themselves, carers, both adults and young carers, have poorer health. Half, more or less, reports that they have at least one adverse health effect as a direct result of providing care, very often through their own neglect of themselves. And, you know, they still willingly want to do that job, but they are so poorly supported. And so one of our recommendations was very much around making sure that the government supports them properly. Employers for carers estimate that businesses could save £4.8 billion a year in unplanned absences. You know, this is huge numbers in the context of even the NHS. And yet there isn't a comprehensive plan for carers in this context. So we definitely think this is an area that could be tackled sooner than later. Now, the costs to the wider system, again, many of you with links into local authorities will know this very well, but the way that it eats into local authority budgets, we think is hugely important, not least because it's putting harm on services, and we described it as a democratic deficit. People don't understand why the potholes aren't being filled, why the bins aren't moving to twice weekly collections, and it's not just the environment. There's budgetary reasons why in some parts of the country they're dimming lights earlier, and again, it's not about light pollution, they're looking to save money, and all of this is in part driven because of spiraling costs in adult social care. It's worth saying that sort of since the report, been having conversations around, particularly with local government colleagues, big differences between working age adults as well as the those who are accessing adult social care when they're older, and perhaps we need a bit more clarity between those two strains. I know that that is an area that Baroness Casey is thinking around, and I think I would probably welcome, because the way that you might approach one might not be exactly, there'll be huge overlap and it's very much part of the same sector, but how do you get government to see those two things as running co-concurrent, but actually potentially being slightly different? But the other issue that we raise is that there's a huge cost in prevention. And as we know, one of the first things that goes in local authority budgets when it's under huge strain is prevention for other health aims. And we're looking at that in all sorts of ways, one of which we're running an inquiry right now. We've just finished our evidence sessions for it, called Aging Well. And the Aging Well inquiry was inspired by this work on adult social care, because if part of the equation here is that you want people to be healthier for longer, and certainly living lives where they're not needing such complex care for as long. You have to start in their 40s and 50s with strengths and balance, and, you know, actively fix pavements. I think Chris Whitty, when he was in front of us, pointed out that if you spent one of the best interventions you could ever run to help an aging society is to fix the pavements properly, because that would save the NHS money. But, you know, Lord knows one budget doesn't feed into the other. So there's been a lot of discussions around pooled budgets and prevention. But absolutely, the strain on local authority budgets is creating this vicious cycle in prevention in all sorts of different parts of society, not least the most deprived, where very often it would have the largest impact. And then separately, of course, the impact on the NHS itself. We talk a lot about delayed discharge, and I know there are many in the sector who, you know, that's where the focus is. But what we also uncovered is that a lot of the data on this is scant, and government currently has no plans. They say that they want to sort this data out, but they haven't really made any progress there. And then finally, we talk about the cost to the wider economy, but in particular of the value of the social care sector itself. So the social care sector being worth 68.1 billion pounds in gross value added to the economy. And, you know, for every pound you invest in social care, you could get a return of £1.75, let alone tens of thousands of new jobs. And it's investing in the sector itself can be a driver for the economy. Now, what this all brings me on to, and forgive me for those who've read the report digitally and knew all of that, but where we are now is nothing much has happened, because in the response that we got from the department, we recommended, for example, that they publish annually an unmet needs assessment for people trying to access social care and are either their needs are undermet or they're not being met at all, and to develop a methodology to measure carers' impact on their life, health, and the economy as a whole. Another thing that we asked them to do is to implement the Fair Pay Agreement, which we know they're trying to do, but also to collect data on how many care workers are receiving universal credit. They haven't got that data. It's not aggregated. They could easily get that data. And to institute proper research into that cost of inaction so it informs and feeds, because if you don't have a cost benefit analysis of any of the changes the Baroness Casey is going to make, short term or long term, it's never going to get done, because that's just how the Treasury works. And in the response, pretty much the government says warm words about the social care sector, but then commits to doing none of the above until the report comes out. And in fact, actively declines some of the more specific recommendations, like a dedicated growth strategy for social care as a sector. And so we find this very disappointing. On the one hand, you've got a sector that has been crying out for decades with, all the possible interventions that you could possibly have under one roof. Baroness Casey is trying to pull them all together, and we are supportive of this, so long it is the last of such inquiries and it is actually going to get implemented. But my concern at the moment is that there are some quick wins that the government could be getting on with now, particularly around data, particularly around wider economic effects. And to the best of our knowledge, they aren't engaged in that kind of preparatory work. That worries me for the short term, worries me even more for the long term. And the last thing I want to report in, and I've said this directly to Louise Casey, it's not in a way her fault. She was pulled off into grooming gangs for a long while. And so the perception among parliamentarians is that there is not much happening with this. They're not seeing the roundtables and not getting the engagement that you've seen. Why this matters, for particularly the long term, is that, as you know, this was meant to be a cross-party commission. This was meant to be, let's get all the parties, swords down, across in the same room, same table, and have this out. There has been one such meeting, and there are no plans for another. And no one is entirely clear what the process is. This is a problem, because what's happening is that people are becoming jaded with the process as a whole. And if what we're aiming for is for all political parties to have elements of this in their next manifestos, so whatever permutation of government, and Lord knows what that's going to be given the polls, whatever permutation of government we get at the next election, we might have some decades-long certainty, because that's what it's going to take for root and branch reform that's needed. In all the manifestos, I'm sensing that some of the enthusiasm for that is waning. It's still there, but it's waning. So I've made that point to her very clearly, but I have and the committee has quite major concerns about the way this is progressing. Our worry is we might get a few things, perhaps by December 2026, because things have slipped slightly. And then the longer term prognosis at the moment is it's still just about there, but a lot of hard graft is going to have to go in on the political side to get us to where we need to be, so that we actually have long lasting and effective change. So on that jolly note, I'll hand back. Phil, I think you're muted.
Yes, I am. I think that's come off. Yes, great. Thank you very much indeed, Layla. My apologies for that slight glitch. Thank you. That was and to time as well, much appreciated. And I was just reflecting on the fact that the impact assessment for the Fair Pay Agreement picked up actually quite a few of the things that you'd made in your report. Obviously, it was only on the Fair Pay Agreement, but it was something like the 10-year present value cost would be 6.4 billion of the Fair Pay Agreement, but the benefit, if you add them all up, came to over 20 billion pounds. Quite clearly a massive sort of 3 to 4 to 1 return on investment of investing in social care. So I think we have a strong case to make. But I'll now, I'm going to ask some some panelists from the Commission to give a response, if I may, later, both to what they may have heard from Sally Warren and from you on their views about what some of the priorities that we should be seeing in the Casey Commission report. And we've been very cruel to the panelists, only giving them 7.5 minutes each, but we'd be grateful if you could attempt to stick to that to allow questions as well afterwards. So thank you very much indeed, Leila, for your contribution there. And I'm going to invite Jess McGregor, who's president of of ADAS, the Association of Directors of Adult Social Care Services, to give her perspective about what Casey might do and some of what she's heard this afternoon. Jess.
Thank you. Thanks, Phil. Hopefully you can hear me okay. It's really lovely to be here to share some of our perspectives. I guess I'm sharing an ADAS perspective, which is a combination really of local government and social care perspectives. It's quite a hard task, isn't it? Being asked to focus on 3 priorities for the Casey Commission, but sticking to their first phase and not talking about money. But I'm going to try and do that. I'm bending the rules a bit. And obviously all of this is set in the context of what we really need is long-term sustainable funding reform. I guess I'm here as president of ADAS and someone who came into social care because it's about people, about dignity, independence, and living the lives we all choose. And I'm really passionate about, I guess, recognising that social care is about all of us rather than other people. And I think too many of us often don't recognise our relationship with social care until we need it ourselves or know or love someone who does. And for me, I guess social care is really the glue that holds people's lives together. And it's much more than just a set of services. And it enables us to assemble the lives we want. 4 in 5 of us will need care at some point, and all of us will love someone who does. Yet, I guess, the reason for the conversation today is we know that glue is being stretched too thin and often applied too late. And too many of us experience a system that feels fragmented and harder than it should be. And I guess, so in terms of thinking about Casey, I think there's a couple of things for me. The Commission has to start with people's lived experience and design solutions that stem from that. And to be fair, I think the Commission has begun in that way. We do need better funding, but we also need a system that's clearer, more honest, and really designed around what matters to people. And I think some of what we've heard from Leila and Sally has highlighted some of the challenges there. So I guess thinking about the first phase of the Casey Commission, there are probably 3 areas for me that I'd be keen to draw out. One is about putting adult social care at the heart of neighbourhood health and wellbeing. The second is about being really frank about the scale of that funding challenge, even though we won't be hearing recommendations around that early on. And then I also think, and this has been increasingly important to me this year as I've travelled about and seen social care happening in different places around the country, I do think there's an opportunity for the Casey Commission to hold up a helpful mirror to local government about the things we could be doing differently or more effectively with the resources that we currently have. So starting with neighbourhood health and wellbeing, I think it's absolutely critical for all the reasons Sally talked about early on, that adult social care is seen as an equal partner to the NHS and not just an add-on. We know every time we talk to people about care and support that what people want is joined up support, to tell their story once, to as few professionals as possible, to be seen as a whole person, not a collection of separate needs. And so integration really matters because it makes life easier. And then given the financial context, whilst there is, no new money on the horizon soon, there is also something about how we shift the existing resources that we have. And I think the greatest opportunity we have is to move investment upstream, to spend less on avoidable hospital activity and more on helping people to stay well. And we won't do that unless health and social care are thinking about neighbourhoods together. I guess when social care works well, prevents crises, it can strengthen communities, it can support independence. But actually, we know that too often people are reaching us long after waiting or being passed between systems. And again, that's not going to change unless we redesign that together. And I guess, as people have already made really clear so far today, that integration has to go beyond health. We have to be linking with housing, employment, welfare benefits, the voluntary sector. And so the emerging neighbourhood health and wellbeing service, I think, is a genuine opportunity to do that. But it won't happen unless social care and local government help design and lead it locally, with really genuinely shared outcomes and a relentless focus on early action. We know that work on neighbourhood health and wellbeing is happening around the country. And we know that we are working hard across local government to ensure that we're kind of there at the centre. But I think, there's something about how an intervention from the Casey Commission could help us kind of make that case more strongly. I guess the second area for me is about the money. So yes, we know that the Commission are not going to make recommendations about funding at this stage, but I do think there's an opportunity to acknowledge the scale and reality of that funding challenge, even if recommendations for how we fund that gap aren't possible yet. One of kind of my reflections this year has been that we're actually not short of solutions in adult social care. Around the country, there is really excellent practice, strength-based approaches, strong re-ablement, innovative neighbourhood teams, creative partnerships. And I guess for me, the problem isn't innovation or a lack of solutions or none of us knowing what works. It's actually that every council at the moment has to choose which parts of its system it can afford to improve, knowing that it can't do everything. So we see around the country the ingredients for what a perfect system would look like, but not one perfect system, because we're making reasonable but difficult choices every day about what to invest in and what not to.
Just one more minute, if you don't mind, please.
Yeah, of course.
Thanks.
And so finally, I guess there's the holding a mirror up to local government. So, and this isn't about blame. Directors are leading under immense pressure, but there are recurring themes where I think there are areas that we could be helpfully reminded about our focus. So one is around homelessness. We've seen more and more people experiencing homelessness, and I think there is a genuine question about whether we're supporting people's care and support needs well enough. Advice and information, too few of us understand what social care is, where we can get help and what our rights are. And I also think there's some work we could do around our Care Act responsibilities around supporting people with care needs to parent. So those are just three examples, but I think being able for the Casey Commission to comment on where they think we could be doing things consistently more effectively, I think would be really helpful.
Thank you very much indeed. Thank you, and forgive me for bringing it to a close. I know that Jackie O'Sullivan, the executive director at Mencap's got to go. So I'm going to ask you, Jackie, if you want to make your contribution now, knowing that you're then going to be dashing off. Thank you very much.
Thanks, Phil. Thank you very much. And actually, I'm usually joined by Kira Lawrence, who unfortunately has a Christmas party this afternoon. And so I've actually asked another colleague of mine who actually I think is lives in Camden, Jess, who's made a 50-second video of her experience of care, which is lovely, but I will share it afterwards, because I think if I try and share it, it will, I'll just spend a minute fiddling around with Zoom, but I'll ping it around afterwards, but it's really lovely. So, I mean, I agree with lots of what has been said. Social care deserves to be valued in its own right, not just as something which relieves pressure on the NHS or enables family carers to carry on working, although obviously it does both of those things. It's the social bit which is really important, and that's especially the case for younger disabled adults. I'm going to pick up on two of the questions in the Commission document, one around neighbourhood health and wellbeing and how we can ensure social care is a genuine equal partner. And I think there's actually a really simple way of doing that. If you make care users a priority cohort if you start from the point of view of the user, then everything else will have to join in behind. So if you make care users a priority cohort, It should be better for them, but it would also drive and foster that closer working relationship between the NHS and care providers at that local level as the neighbourhood health services are forming, and therefore should provide lasting partnerships and relationships that should endure. The second question I'm going to pick up is around voice and co-production and advocacy, which of course, of course they need to be baseline standard. And actually, I'd go wider than that. And I'm really heartened to hear that Sally and Sophie have been speaking, because if we had conversations with people at various life stages about what sort of support, whether it's health, employment, social care, that people really need to live life to the full, then that would be a much better for people. And then some wider observations, I guess, just in general about and to feed into the Commission. We tend to talk about social care as a single system. But we also, in the same breath, say that it's important that it's person-centred, and we need to find a way of bridging those two things, because what happens is that people are left to navigate it from scratch almost every time they experience it. The second point is that we have some really distinct cohorts of people that we are really letting down. And I'm thinking particularly of the 2,000 people with a learning disability or autistic people who are locked away in ATUs, many of whom could live in communities if the right support was in place. So actually thinking about the needs of particular groups like them, I think would be a good starting point. And then finally, we need to stop the practice of charging working age disabled people who rely on benefits to pay and contribute towards their social care. Benefits just aren't enough to live on as it is. So those would be my three additional observations to feed into this. And thank you. And I'm so sorry I'm going to have to run off. It's been a very interesting session.
No problem, Jackie. And please do share that video with us. I know that people would very much like to see that.
I will.
So that will be very good. Well, thank you very much indeed. And again, for reasons of timing, can I invite Kirsty McHugh, who's the Chief Executive at the Carers Trust, to talk about, from her perspective, the things you'd like to see from the Casey Commission, our third panelist today. Can't see. Oh, there you are. Great. Hi, Kirsty.
Thank you very much indeed. Yes, I am here, and I do have a Christmas party to run. They don't want to see me for long. But I do need to go and show my face as chief exec. So that whole thing about where you sit is where you stand, and we as Carers Trust run the local carer services around the country. Network organisation, 136 organisations out there. So what I say is very much coloured by what we are seeing in terms of network sustainability and the challenges on the ground there. So three main things we'd like to see in relation to Casey. The first one isn't technical, but it's around turning the dialogue on its head. So we are starting with the people receiving care, the people who are giving care, the carers. And again, you see in this space, big, long policy documents and unpaid carers, there they are, little paragraph, page 63, whatever else it might be, etc. And actually, if we are serious in saying that and recognising that unpaid carers are doing the bulk of the care out there, if Casey can do anything to shift the dialogue and recognising that so it's a political positioning thing, that's what I'd really like to see in relation to that. So that's a big picture thing. There's then, of course, a lot of the technical stuff that makes that reality, the National Strategy for Unpaid Carers, shared outcomes between health and social care. I'd like to see some recognition, some honesty that the neighbourhood health agenda, all of which we back this, is likely to put more, it's going to have a bigger ask of unpaid carers in relation to this. So if we're thinking about, more care, in the homes, out of hospitals, what are we asking the unpaid carer population to do in relation to that? And then what is the support that we want to put in behind them? Now, going on to the support element of it, the second thing I'd like is for the Casey Commission to be loud and proud that identifying carers is a really important first step, and that we need to do more the health and social care system indeed broader, schools, other parts of the public sector, and indeed non-statutory services around identifying carers. And we've had good progress, I think, in a lot of different areas, but still 70% of adult carers who do get an assessment are signposted to, oh, nothing, maybe a website that doesn't exist anymore. It would be advice and guidance, nothing more. And the figures that we have through ADAS and others showing the complete drop-off of availability of respite, short breaks for unpaid carers, particularly in England, is scandalous. And that's the one thing that unpaid carers tell us again and again they want is just a bit of time away from their caring role. And I think we've got a crisis out there about access to respite. We work UK-wide. There's a right to respite in Scotland. We administer a big scheme in Wales, which is paying for respite. So actually, England is literally the poor relation. So I'd very much like that as to be part of the conversation. The third thing, unsurprisingly for me, is around the sustainability of the local carer centres themselves. So to be clear, some of them are delivering regulated services and the domiciliary, home care services, etc. But a lot of them aren't. So there'll be advice, guidance, employment support, social prescribing, health and well-being, counselling, social groups, all that sort of thing. So, a lot of unpaid carers will say it's the thing that keeps them going. But they're pretty much under the radar. That said, I go around the country, visit a lot of them, and you'll often find the DAS there. You'll find the counsellor there, and they love them. They really love them. But at the same time, you then see the commissioning behaviours, the contracts with no uplifts. Sort of being asked to do a hell of a lot more for less in a way which probably isn't sustainable longer term. And if we're thinking about this next period for Casey, what we're also finding is that local government reorganisation and the ICB changes are having detrimental impacts in terms of voluntary sector providers. And so we need to look after this bit of the infrastructure whilst we go through the transition. So Phil, that's my quick counter through. There's some of the things we'd like to see out of Casey. I think, the mood music at the moment is good. We've had a lot of engagement. As Dom said, she's been to see local carer services. She's had, a lot of engagement there. So that bit is good. Not entirely certain the ministers get it, but, there we go. You can't have everything.
Kirsty, thank you very much indeed. I'm going to move just onto our last panel speaker. It's not going to be Una Smythe because she's unwell at the moment, but stepping into her shoes is Mark Moulding from Skills for Care, who's going to sort of give us the workforce perspective on what we might try to see coming from Casey. Mark, over to you.
Thanks, Phil. And if you were hoping to hear from our fantastic chief executive, I can only apologise that you've got me instead this afternoon, but I promise I'll do my very best to talk to you about all the things that Ona would be saying herself if she was here. So, as the strategic workforce development body for adult social care in England, you won't be surprised to hear me say that the adult social care workforce should be a major consideration for the Casey Commission. And I completely agree with what everyone else has said so far about it all needing to start with the people who draw on care and support. That is absolutely vital. And then after that, it's the workforce that delivers that care and support. So it's important to focus on them next. So we need to be realistic about the challenges we still face, despite some positive recent numbers in our data showing that the workforce has been growing for the last few years, with turnover rates and vacancy rates continuing to fall. We know that we're going to need around 470,000 new posts by 2040 just to keep up with the projected growth in the population over the age of 65. We also know that complexity of needs will increase. For example, the number of people with dementia being expected to rise by 43% by 2040. And we know we're going to need a more integrated workforce focused on personalisation, prevention and well-being, different roles and skills, and that community focus we've been talking about. But just to briefly take a step back from those recruitment and retention challenges that we hear about every year, because what would be wonderful is if the KC Commission could address some of the systemic challenges facing adult social care, which we think the creation of a national care service is a really good opportunity to do. So, broadly speaking, those systemic challenges are four things: a lack of public understanding and status for the sector, fragmented sources of funding, dispersed levers for change across all sorts of different bodies at the national and local level, and of course the large, complex and fragmented nature of the sector itself, where success exists in pockets, but it can be difficult to scale that success more widely. So there are plenty of challenges, but we already know a lot of the solutions, and many of those were set out in the workforce strategy that we published last year as a result of a really wonderful collaboration with the whole sector. So we think there's lots there that the Commission can take and build upon. We know that pay supports recruitment and retention, so the Fair Pay Agreement is a really important step forward, but it's important to think beyond that, because on its own, improved pay is vulnerable to competition from other sectors who could simply increase their own pay in response. So we need to link pay with wider terms and conditions and the care workforce pathway, which provides the first universal career structure for the adult social care workforce. And that will ensure that adult social care is an attractive career that's rewarding in every sense. In light of changing needs in mental health, digital skills, and dementia care, we need to continue the expansion of the pathway, which is a great framework for skills development. And we also believe that all workers should have dementia training aligned to the Dementia Training Standards framework and the roles within the care workforce pathway. Delegated healthcare means increased expectations of care workers. It's absolutely key to realising neighbourhood health, but there are all sorts of challenges around the resourcing, accessing and funding of training, and capacity across both health and care to support safe and effective delegation. And current funding flows mean there's not enough of an incentive for prevention in social care, and they don't necessarily follow the delegation of healthcare activities. So it'd be great if the Commission could seek to address that and ensure that funding flows recognise the increasing expectations that are being placed on our care workers. We also need to address the perception of working in adult social care, in particular to attract more men, younger people, and people with tech skills into the sector. So we'd love to see the Commission endorse the recommendation in the workforce strategy for a 10-year attraction plan built on cross-sector and cross-government partnership. And on integration, we know we won't get all the levers of change across health and social care to pull together through one single workforce strategy across both health and social care, because those levers are quite different. So we can only do that through two strategies with shared priorities, accountabilities, and implementation where it's appropriate and helpful for person-centred care. So it would be brilliant to see the Commission recommending that the 10-year workforce plan for health is complemented by a national workforce plan for the rest of adult social care, which could be built on all the work we've done so far on the workforce strategy. So ultimately, we believe that the Commission should build on what we already know works and all the existing momentum that exists across the sector. We think it can be a real vehicle for change, and it should be one that recognises the solutions that, through working closely and constructively together, we've already identified.
Have you completed, Mark? Yes.
Yes.
Great, fine. I just want to make sure I hadn't cut you off. That's lovely. Well, thank you very much indeed. Thank you, each of our panel speakers. I'm not sure we've got all of them still with us, but we've now got an opportunity to open up to commissioners for questions, either to any members of the panel or indeed to Layla. I think you're still with us. I hope she's still with us. Great, as well. So if you'd like to ask a question or make a comment on what you think about the comments that people have made about the priorities for the KC Commission or the Select Committee, please show me now. Yeah, I've got Oliver. Start with you.
This is maybe an unfair question because I don't know how we're going to coordinate the answer, but I'm just wondering if we have a shared understanding of what good looks like, essentially, because everyone's got their own perspective individually about what they need from the report or from the changes that we need to see. But is there a way of getting to a shared understanding, even on just quite a basic level, about what we think good looks like going forward. I'm thinking probably less in terms of the different bits of the system that are providing care and more about the people that are receiving it at the end. What do we think that system should look like for those people? And are there some common themes that we might want to just pull out as the focus of what we want to see change?
I suspect that everybody on this call will have a very clear understanding of, for them,
yes,
what good looks like. And it's been quite interesting. I think a lot of people speaking about starting with the needs and the lived experience of people that draw on care services to decide to describe that. I've certainly been working with one organisation who I think are on the call, where they've looked at the old Maslow's hierarchy of needs, about everything from physiological needs right through to self-actualization, and that the social care system should be tailoring its services to ensure everybody gets all the needs that they have, right from the level 1, as it were, to level 5, to live the life that they want to live. But I dare say there are other models, many other models and ways of working that people might have as frameworks. But that's essentially, you heard Sally talking, I think, about independent choice
and control,
as being major themes, which then have to be translated into the actual service, the actual intervention, the way that the actual service is then delivered. So you've asked a huge question.
Indeed. Phil, rather than hijacking the meeting with what is a Pandora's box, perhaps when people answer other questions, they might just say a couple of words about what they think good looks like. Yeah, that'd be great if people do that.
Yeah. I mean, there's a whole range of things about what good looks like to make that happen. But first of all, what is the outcome that we think the social care system is trying to achieve? Mark, you got your hand up. I guess you do quickly respond to that.
Yeah, absolutely. Because it can feel sometimes like you've got dozens, if not hundreds, of different organisations and people with different views and different things they want out of the system. But one thing that we found, at least in workforce terms, is in the development of the workforce strategy, if you bring those people together and you get them focusing on one thing like the workforce strategy, you get to that level of agreement. So that's something that involves dozens of organisations from across the whole of social care, plus colleagues from health and education, and they all came together to produce this strategy under our coordination that ultimately is broad agreement on what needs to change in workforce terms. So a lot of people would say it can't be done. I think we've proven that actually it can.
Oh, thank you very much, Mark. I've got Kirsty, and I saw another hand that's gone off my screen at the moment. I'll take Kirsty first, but I think I saw another hand up as well. Kirsty.
Thanks. I think one way to look at it is, what might, and we don't have this conversation very often, is what might an inappropriate care load be on an unpaid carer? So that's sort of, but by thinking about that, you then can think, okay, what should the state provide, whether it's through local government, NHS, whatever else it might be. But at the moment, of course, we have young people, kids doing 50 odd hours a week of care, including intimate care or doling out medicines, or it could be somebody who's in their 80s, doing sort of hard physical stuff. So for me, thinking about what good looks like is quite useful to look at through the carer's lens, because if we get the care right, that actually diminishes the pull that sits on their shoulders. But that question about what's inappropriate, I think, is a really important one for society.
Thanks, Kirsty. I've now got Sam, and then Leila wants to come back with some thoughts from the select committee. Sam.
That Jess suggested she might speak before me, but I just wanted to say, from a Lens for England point of view, what we hear from members is really ordinary stuff about a good life. And I think sometimes we think system and we get wrapped up in lots of system things, and we don't think how that system is helping people just do that stuff that matters.
Okay.
All our ordinary good lives.
Thanks, Sam.
Well, sorry to interrupt. I think Tom Hughes has got his hand up, but I think you can see it because it's against the yellow background.
Okay, well, I'll take Leila, and then I'll take Tom and Jess.
Thanks. So to this question, sorry. Not
yes,
yes,
yeah, go ahead,
sorry. Well, just to the question about what good looks like, I totally agree about, listening to people with lived experience, co-production. That's very much where the committee is. We try, and actually it was really moving to start a lot of our evidence sessions with either roundtables or people with lived experience speaking directly to us. But a reflection that we're getting from a number of different bits of work that we're doing, whether it's this or we did one on mental health, for example, the government loves to talk about co-production and it loves to talk about lived experience. And actually, I think it's really ill-defined what that actually means. And I think it ranges from a constituent wrote to me once to, genuinely embedding what best practice in co-production looks like as one of the measurable metrics by which they might judge outcome measures. And that is a very wide spectrum of things. But I think that rather than we focus on what good looks like from a national perspective, because I genuinely think this is going to be slightly different for different parts of the country, for different population groups, we need to allow that variation in the system. But I think there needs to be a sort of a minimum offer that's agreed, and I'm not even sure we're at that point. And I think some of it is just common sense, but actually the spelt out what minimum offer, what is the minimum that a reasonable taxpayer might expect that the state provides, what's that national conversation about what carers provide? I think that what does bad look like for a carer? That's a really important question because that's that limit, and I'm not sure that conversation is had enough. So thank you for that thought, Kirsty. But actually, for commissioners, for local authorities, for health and well-being boards, whoever it is who ends up in whatever landscape Casey Commission might take us towards, what does genuine co-production look like? And what best practice of that looks like? I'd like to see that bottomed out a bit, because at the moment it's a lot of warm words, but very, very patchy variability in terms of how well it's actually embedded in outcomes, as opposed to just consulted at the beginning.
Thanks, Leila. I'll ask Tom Hughes next, who for some reason doesn't come up on my screen, but Tom,
that's all right.
I can see the yellow background, and that's why we can't see your hand.
Camouflage, it's camouflage. Yeah, no, thanks for that. Super useful and interesting. Loving choice and control. The organisation I work for is called Community Catalyst, and that's our mission to give people more choice and control around the care and support they receive. And we do it using helping people set up micro enterprises, which, they're not the biggest element in our health and social care ecosystem, but they're a very important part of the health and social care ecosystem where they exist. The way I see it is like a marble jar. You've got your big marbles, which are the care agencies and the PAs and all the other systems, the NHS. But in that, there's lots of little gaps, and they're quite often filled by micro enterprises. What are they? They're local people doing things like helping getting the shopping for Mrs. Jones, doing the gardening, a bit of companionship, personal care, all these sorts of things. And we work nationally to make sure that they're safe, legal, person-centred and sustainable. But quite often with all these big changes, strategies and the way change comes about, they're often forgotten about, but they're so important. I'm just wondering if the KC review is going to look at micro enterprises, local people, communities that are helping local people, sometimes informally, but also quite often as micro businesses, very small businesses. So is there anything on that front that's being looked into?
Tom, my strong advice would be to make connections with the Casey Commission and send in those case studies. I know that they're working on a kind of case study approach, looking at individuals and what's happened to them. So some great case studies from you about what you've just described. I think they would be very interested in hearing. So, and if you're not clear about how to contact the Casey Commission, I'm sure many people on this call will be able to help you. So, but that would be yeah, and by the way, always copy in the department. Whatever you send to the Casey Commission, I suppose this is something for everybody. Send that off to Sally as well, because although the Casey Commission she'll write her own report, getting sight of all the what's influencing her thinking might be very helpful for the department. Jess, I think you wanted to come back on some of the comments, or perhaps that question that Oliver threw into the mix.
Yeah, it was just very quickly on what good looks like. So I agree. I think we all have different priorities, and we do sometimes have different visions in the round. But I think one of the things that struck me is when we come together, many of us on this call, there's quite a lot of consensus or areas where we don't disagree. So I think across the sector, there's a lot of consensus around that kind of vision for what a good life looks like and how social care can support all of us with that. I think there's huge consensus around starting with people first and co-producing. and prioritising unpaid carers and a national workforce strategy, of which the Skills for Care work is an example, are all areas where there is no disagreement, I think, in any of the conversations that I've had. And I think the work that we've done across the sector on the Time to Act roadmap, which is a roadmap for reform and sets out what good looks like, how we can get there, but also critically what's in our gift and where we need government's help. And I think the work we do together across the sector to move forward the areas of that roadmap that are already in our gift, again, is incredibly helpful.
Thank you very much. Any other questions? It feels to me that in terms of responding to your question, Oliver, a number of things have come out from that. One is you start with the people who draw upon those services, the unpaid carers who are a key part of their lives, and find out what sort of outcomes you want to try and achieve through the services you provide. And how you go about doing that. I think Nadia put consistency as one of the key things, and that's right. Having a different carer every day doesn't help any older person, sitting in their own home, seeing somebody new every day, or being looked after. And co-production. Certainly a whole major theme of how everyone with working age adults has as at the core of their practice. That's what do you do if you're not co-producing something with somebody who's a working age adult. Why are you doing it? But for me, once you've got that description, however you want to do that, from, as it were, caring for people safely right through to what I call the self-actualization, that complete spectrum of needs that every human being has to live their best lives possible. The question is, how do you commission that? That must be the next question, I suppose, that follows on. What is it that a commissioner does to commission those kind of services that deliver those kinds of outcomes, working in those kinds of ways, and doing so tailored to personalize that service to the needs of individuals, because no one individual is the same on this call or any other service you want to name. And that's the key about social care, is it's so personalized and tailored. So how do you commission well? And I think if Casey can say some good things about what good looks like, both for the outcomes of what commissioning is trying to achieve, but what good commissioning looks like, I think that would be quite a powerful part of the process. And for all of that, we need, and I think the point has been made, the workforce to do that. Have they got the right skills? Do we have enough of them? But the consistency and the quality, the training, the pathway, the career structures, the different specialisms. I think Skills for Care have written about that extensively. So I guess if we can all see that might come out of Casey in the short term as well. And I've not covered everything that people have said, but it does feel to me that there's a sort of a logic to those things that people have said, that if Casey can come forward with all of that. For me, the question I put to Sally about how that connects up to what the department's doing and how that becomes a coherent strategy with an independent person designing for the government what they see as the direction for the National Care Service, at the same time as the government wants to carry on transforming social care through its own endeavours. That for me seems to be absolutely critical. So making sure that there is we don't end up with two different types of views of what good looks like in the care system, one from Casey and one from the department, but that they are integrated together seems to be absolutely critical. And I think all of you have mentioned the National Health Service in one shape or another, particularly neighbourhood health services. And I like the idea of keep on calling it neighbourhood health and wellbeing services, or some other wording, so that we get away from it being just about delivering what the NHS wants in the community, that is as genuinely broad brush and dealing with all the needs and the services that people might need, rather than just the NHS. The question about funding, and I hope the members of the Commission, people on the call, will forgive us for focusing on what's going to be here in 2026. We will, as a Commission, have a discussion about how you fund the social care system. It's frankly, for me, that discussion, the Casey Commission report in 2028 that says how we should fund the social care system, is not a social care question at all. It's a tax question. It's how you raise money and then spend the money. It isn't about how to design the social care system. And I'm intrigued. We will end up having what could be close to being a political discussion, because you're going to be discussing taxation, as will she. So believe you me, it's not that we've ducked it, it is that we know that it's coming, but we know that Casey is working in phases, so we're, as it were, working alongside that process for the way we're working as a commission. I'm aware that we're just approaching the point where we should be moving on to the next part of the thing. Are there any other comments or contributions? I've tried to sum up some of the things that I think people have said. Is there anything else that any of the commissioners who haven't spoken that would just like to comment before we move on to another part of the agenda today? Yes, Linda, glad.
Sorry, I don't know if you can hear me. My
Yes.
thing wasn't working to put my little hand up,
Okay.
so that's why. I suppose, I mean, listening to all this, I mean, I've been working in the NHS for getting on for 50 years. I've worked clinically across health and social care, and I'm currently chair of an NHS trust, which is going to be part of a new neighbourhood plan, working really closely with our local authorities, VCSE, representatives of the community, etc., which I think is really exciting. I suppose it's just when you listen to all this, I feel we've been here before a long time. I mean, Andy Burnham's great report, whenever it was, which did a lot of this groundwork before. And I suppose my point is, I think that it's really important there are good relationships across the system. And I'm very lucky within my patch, we've actually have those, which is great. But it's necessary, but it's not sufficient. You've got to actually really get down then to actually how you're going to implement this. And this is therefore about influencing your commissioners, working really closely across the parts of the health service which are often not really integrated, like primary care and general practice. I think they're really important as well. But I do think the opportunity for the neighbourhood health is a sort of it's a testing ground, isn't it, for how some of this might actually work? Although there's going to be no new money. So we're going to have to somehow move our resources around. And of course, that's when conversations get really difficult. So all the time, everyone's been talking great stuff, and I think absolutely right to think about what good looks like, etc. I do think we know, actually, because I think we've listened quite a lot to people who use the services. But I do think there is a crunch about the money, and that will be going to be the difficulty.
Thanks, Linda. Okay, and I've got Nadra. I see you've got your hand up. I'll let you finish off before we move on to the next section.
Thank you. Just a real quickie. I think we need to be very mindful that social care has moved the dial, consistently over decades, and I think that's an important thing to kind of just recognise. And we're now into clinical delivery in many parts, with the healthcare models being changed. And I don't think there's a vision that actually looks at that in the kind of National Care Service angle, because our staff have to be trained to that level. So all I wanted to say really was that dial has carried on moving, and I don't know how much more capacity there is to move it before we get into this kind of mini hospital, which lots of people already run, and it's not recognised. I think that was at the very beginning. The value base of social care needs to be much higher on everybody's agenda.
Thanks, Nadra. And that's both a warning and a reminder of Sally's point at the end of optimism that actually the NHS has got a lot to learn from social care, not least how to work in partnership with people who are not the NHS, let alone working with people with inside the NHS that they don't necessarily work in partnership with either, between hospitals and the community, for example, but also that social care, person-centered, holistic approach, understanding the whole person, not just the organ or the limb or the disease or the condition, which is the NHS focus. And I think that is a very big picture, long-term vision, but I think it's one that the Neighbourhood Health and Wellbeing Service could definitely contribute to if social care gets to play its part as a genuine equal partner, as was mentioned at the beginning. Oliver, I'm going to hand over to you now to take us through the last part of the meeting. Just to say to everybody, as a result of this conversation, we will draft a summary of the key points that have been made and the sort of outcomes that we want to see from the Casey Commission. We'll write direct to Baroness Casey herself. We'll copy in the Minister, Stephen Kinnock, who somebody I think on the chat has said also talks about a neighbourhood health and wellbeing service. So maybe the door is ajar, at least there, as well as to Sally Warren, of course, who's in the department as the Director General. So thank you very much indeed for the panelists. Thank you for all your contributions and for keeping us to time. Much appreciated. Thank you to our speakers, Sally and to Layla. And I think both of them have now left. But I'm going to hand over to Oliver, who's going to tell us about what the implications of the budget for social care. I think that's what's on the agenda. Anyway, over to you, Oliver.
Thanks, Phil. I'm probably not going to go into a huge amount of detail because I think most people on this call will know it better than I do, frankly. But if anybody wants to sort of raise a point or a comment or a question about the budget and particularly sort of the NHS first approach that the government's laid out or social care, then now's probably the time for people to sort of raise that point amongst friends. Anybody got any comments or thoughts about that? Okay, thank you, Naomi. I can't see any raised hands, so I'll sort of take that bit as read if you don't mind. I think it's probably rather than opening up that another Pandora's box. In terms of other things that have gone on, so the Commission wants to let people know the Commission's received no less than 5 letters from the government since the last meeting. Cease and desist letters, I believe there were, weren't they? No, is that right? No. From both ministers responsible for children, DfE and DHSC, minister responsible for women's health, minister with the responsibilities for learning disabilities, and from the minister responsible for mayoral and ICB alignment and accountability. On which point, it's worth saying that Phil, Steve and I met with Karen Smith, what was that, last month now? It was last month, wasn't it? Last month, to have a conversation particularly about the role of devolution, democratic accountability, and local accountability in health, because as you all know, within the English Devolution White Paper and various other places, there are conversations happening around the role of people like me, mayors, the changes that we're seeing to the ICB, the role of ICPs, as was, given that I am the chair of an ICP, notionally at least. So what changes we could look forward to or perhaps press for in that space. And that's what the meeting with Karen, that's what that was about. I think it's fair to say, if I'm being polite, there was no shared agreement about what that might look like going forward. I think that was a fair comment. So I'm probably on the more adventurous end of that spectrum. Phil, Steve, I think you probably are too. I think the government, for valid reasons, to be fair, have some challenges and concerns about the role of mayors in that system, and therefore maybe aren't quite as keen as I am to say things, for instance, like a deputy mayor for health taking on some of the sort of commissioning responsibilities in place, a la the PCC model, which is the best model I can think of as a analogy. We had that conversation. I think we still want to explore some more of those perspectives and angles with the government, and there is a meeting planned with Wes in the new year. So we will keep on pushing on some of those questions and challenges, and we'll sort of report back as and when there is any progress to talk about. If anyone's got any perspectives on that, I'd be really interested to hear any thoughts about sort of devolution, mayors, the role of local and democratic accountability in that system, because I think it's an interesting space. And, as I say, we are going to meet with Wes and talk about that some more. So any thoughts, please do share.
Oliver, can I just check in one other thing? Yeah. We talked about and we have talked about this as the Health Devolution Commission for nearly 5 years now, about how you have the vertical accountability of the NHS and the horizontal accountability either to local government or indeed now to mayors of NHS, and the vital role that now the new strategic authorities will play. Something that came out from the discussion with Karen, which I don't think we're betraying any confidences, is one was she played a lot of importance on the relationships between leaders in the NHS and leaders in local government and mayors. We stressed that relationships were necessary, good relationships were necessary, but not sufficient. There needed to be not just personal relationships, but structural relationships.
Yeah, that's right.
That's the debate I think we're trying to carry on to have. The second one that was I wasn't expecting was
Sorry, Phil, you need to unmute yourself. Sorry.
Sorry, yes. Advanced Foundation Trusts. Now, this is large hospitals that want to sort of go to the next stage of their development and become an advanced foundation trust. One of the key criteria, the threshold you've got to pass will be to be working in partnership as a hospital, not working in isolation. And we talked a bit about foundation trusts being anchor institutions. And this is directly related to both mayors and local government, in that if a hospital decides to recruit in a particular way, buy goods in a particular way, the impact on the local economy is huge. And of course, mayors like Oliver have a complete responsibility for local economic growth. So the relationship between mayors and the very large institutions called hospitals that appear in every mayor's area is critical. They make the difficult decisions badly about recruitment or procurement or purchasing in the area. It can knock sideways the mayor's economic strategy, and vice versa. The mayor can make decisions which might not be helpful to the hospital. So the idea of a joint health and economic strategy between advanced foundation trusts, or indeed all trusts and mayors, was an idea that emerged, I think, during that discussion, and which Karen kind of pointed us towards as an opportunity for getting beyond just good relationships and into partnership working. So that's a long sentence from me, but I just wanted to pick that up, Oliver, because I thought it's not just about deputy mayors and all of that stuff and ICBs and who sits on what board. I think it operates at the operational. So Catherine, I can see you got your hand up. My apologies for rambling on. Catherine.
No, that was really interesting. Thanks, Phil. Yeah, so Catherine Merrifield from the Health Foundation. And just on what was being said about that kind of role of mayors and health and vertical and horizontal accountability, just to flag that I think something that will be really interesting in 2026 is this new health duty for strategic authorities, and actually thinking through what does that mean for the role that strategic authorities and mayors play in the wider system, and how to ensure that that kind of amplifies rather than duplicates existing duties. And we think there's a real exciting opportunity there. But just to flag that at the Health Foundation, we will be doing some thinking in the new year and possibly running some roundtables to try and explore how do we make a real success of that health duty, because it feels like a real opportunity.
Yeah, thank you, Catherine. I mean, as the only mayor to have taken on the ICP chair and role, and you'll know because you guys were involved in helping us about the Health is Wealth report that we've done, and other things besides. Really keen to make a success of that opportunity, but probably go a bit further maybe than the government are currently thinking as well. So really interested to kind of hear ideas and thoughts, and maybe talk to colleagues about how we might be able to do more in that space. And no such thing as a bad idea really at this point in terms of how we might be able to press the government and challenge. I think because I'm really interested in how we take that forward. Dr. Taylor. Could somebody unmute? There we go.
I mean, I think, sorry, I'm the chair of the LGA Health and Wellbeing Committee, and I think there's a lot of concern amongst councils that devolution shouldn't mean taking away responsibilities from local councils and handing them upwards to mayors. So I think we do have particular concern over them. To give the example, we have the largest ICB in the country in North, one mayor or two mayors sitting on that instead of 40 different local authorities. Yes, it's a representation, but it's not ideal. So I think we need to think through that we don't actually make devolution the wrong way, going up and taking away roles of local councils.
Yeah, and to be fair, I think that's something that as mayors we're always kind of very conscious of is not the approach to devolution being the right way as you describe it. So actually this is about taking powers away from government, investing them in local communities, rather than taking powers up from local councils, investing them in MCAs. And that for me is the trick that we need to pull off. Phil, you want to say something?
Yeah, well, I think thanks, Wendy. That was an important contribution, because it also came up in the conversation with Karen Smith. I think one of the things that the government is thinking, from what I can gather, is the critical role that health and wellbeing boards through local authorities are going to play in establishing the pattern of neighbourhood health and wellbeing services in their area. And I think I'm picking up that this is where local government can, I mean, there's lots of other things that you can be doing, I know, but this in particular, all the discussion we've had this afternoon about the importance of the neighbourhood health and wellbeing services and the role that they'll play with social care, holistic thinking and all of that. that the leadership of the health and wellbeing boards in this regard is going to be really, really important. Now, whether you've got the resources and so on to do that, I'm not, but certainly in terms of the power in the system, which as a former minister I always think about, I think that's something to grab and to make sure that that you take a leading role to put the democracy as well as the partnership and the voluntary sector and all the other things that we know about what would make it work. I think if the health and wellbeing boards do a great job there, that will be the difference that could make the difference.
Well, thank you. Any other comments before we move on? No. Okay. All right. Thank you, everyone. In which case, that's kind of essentially the just report back bit of the meeting, which really just leaves part 3 of the meeting, which is the agreement of proposed programme for 2026. There is a document that you'll have been sent. So we do need to agree that future programme for the Commission. That report's really good, I think. So we've done that in consultation, as you'd imagine, with partners. So I hope you've all felt able to contribute. It includes a greater focus on advocacy and a Labour conference fringe meeting that I think we're hoping to hold. And the next meeting is on public health, which is, again, all too often overlooked. And that'll be in the House of Commons in person at 2 p.m. on Monday, the 23rd of March. Steve, I think you're going to send an invitation around in the usual way. So is there anything anybody wants to quickly add on future programme? Any thoughts, comments, questions?